Thank you, Rumbi. Well, I'd love to welcome our next panelists to the stage. We have Nabeeha Kazi Hutchins, who's the president and CEO of PAI, and Dr. Ayman Abdelmohsen, who's chief of the Sexual Reproductive Health and Rights Branch of the UNFPA. So thank you both, and thank you to PAI for being one of our partners today. So we're going to take a look at contraceptive access. And, I don't want to talk about all the many, political challenges that are out there, because that could take a whole session, and really talk about innovation in this space and increasing access to contraceptives. So Nabeeha, I want to start with you and just talk about your role at PAI and how you've been working with civil society and other partners to accelerate access to modern contraceptives and really enabling an environment for access.
Thank you for that question, and it's wonderful to be here with you as well as Ayman. UNFPA and PAI, we've been partners for over 55 years, and we've made some great progress. There's a lot more to come. As it relates to PAI's role and the role of civil society, our work is ensuring that the promises that are made, that the funding that's committed, that the health services that are guaranteed are actually delivered upon. And in order for us to do that, it is about ensuring that policies and laws are reflective of what communities need. It's about ensuring that health services are trusted and delivered through reliable health systems. And also, quite frankly, and most importantly, that women and young people know that these services are available. And this is all part of building an enabling environment. When we have an enabling environment, we see great results. Governments deliver increased financing for contraceptives. We see impacts in access, and we see rights realized and communities thrive.
And Dr. Abdelmohsen, so what is the role of multilateralism in advancing health innovation, particularly in family planning and contraceptive care?
So that is a very good question, and we can continue talking about it for a very long time. But let's start with identifying that there is a persistent problem that the global community is facing, which is the persistent unmet need in family planning, meaning that all of the solutions that we've been adopting over the past several decades are still not enough to reach to those underserved. So that means that we have to start thinking of innovative solutions to make sure that those women who are deprived from having access to a modern and reliable contraceptive is having access. So multiple levels or multiple layers of these innovative solutions come into play when we are talking about multilateralism. First of all, one entity or one approach will not serve all. This is where partnership with the private sector and civil society becomes of paramount importance. I give you a very simple example. We as under UNFPA, we have the UNFPA Supplies Program. We're the biggest provider of donated contraceptives to the developing world. During the COVID days, because not almost, all of our contraceptives that we procure for our developing countries are coming either from the Far East, India and China, or from Europe. With the complete halt of supply chains, we were not able to move anything to Africa. And yet there are many manufacturers in Africa who are trying to provide quality products, but the business model is not sufficiently healthy in a way that will make them competitive in the market. And at the same time, they have to make very heavy investments in quality assurance mechanisms so they become qualified. So we, as a UN agency, be able to buy from them. We only buy from manufacturers who are pre-qualified by WHO. So it gives you an idea of the scale of the problem. So this is where we have to work into an innovative solution where we look into how we can improve the decentralization of production, how we can look into innovative solutions to improve the distribution of these contraceptives and create a better market that is competitive enough that can reduce the actual price of these contraceptives for those who cannot afford to pay. So multiple layers of collaboration, and this is where multilateralism becomes very useful when it comes to innovative solutions.
You really need a multi-sectoral approach. So Nabeeha, can you talk a little bit about how PAI is addressing some of these challenges?
Well, first of all, we also have to recognize that there's been great achievement and advancement, right? Today we have almost 870 million people who have access to contraceptives. On the other hand, we have far too many who can't access, over 250 million. And we also know that 50% of pregnancies are unintended. So there's a lot of work to be had. And it's very exciting to see the policy commitments from government. It's very exciting to see this push to ensure that laws and frameworks reflect the needs of people. It's very exciting to hear of the innovations to ensure that modern contraceptives are meeting the preferences of communities. But it does us no good if knowledge and innovation and services and programs remain on the shelves and no one accesses them. You know, there's a saying in global development, no product, no program. I would agree with that to some extent. What we need to add is if we don't have people, we don't have impact. And so as PAI looks at these challenges, we're doing several things. We're looking at ensuring that the accountability mechanisms driven by civil society, who are the truth tellers, who are paying close attention to what's happening, are elevating visibility around policy and funding commitments, that they're at the forefront of knocking on the doors of government, of donors, of even multilateral partners, saying, you promised these things to us, where are they? And the results, you know, this is something that is not that complicated, but it actually requires sustained support, funding, and intentional integration of civil society, people-led movements, whether that be for sexual and reproductive health and rights, contraceptive access, addressing issues around vaccine hesitancy, malnutrition, climate. When you have a super-powered people movement, people show up. And I will share a few examples. You know, even with our contraceptive accountability and advocacy work, we've had cases where governments are now increasing their domestic financial commitments to contraceptives. Malawi, 9% increase. Tanzania, almost 10% increase. Benin, 430% increase. Why? Because people showed up and asked. You know, we have this incredible program over 4 years with a robust civil society network of over 700 civil society organizations, partially supported by the global financing facility. And over those 4 years of a coordinated, multi-sectoral, also multilateral partners in this, we saw over 100 advancements on the policy and legal side that not only unlock access to sexual and reproductive health, but what it also did is unlocks access to opportunity and achievement. And those are all the things that we have to remain steadfast on, not only in times of crisis, but consistently every single day throughout the journey of progress.
Right. And Ayman, how is UNFPA thinking about their role in being able to facilitate and increase this access?
So, first of all, UNFPA being a UN agency, and we work with and for member states. So, our main counterparts are the governments. And so, our main point of entry is to invest in our comparative advantage and having this trusted relationship to influence policies and programs at the country level. This is what we do. I give you an example. Over the past several years, we have redefined our relationship with governments when it comes to providing them with donated commodities. Instead of providing them with the contraceptives with no strings attached, we have compacts that are being signed with the government, where the government commits to allocating from its domestic resources the allocation. Nabeeha was giving some examples to allocate from its domestic resources for the financing and the procurement and the distribution of contraceptives and maternal health medicines as well. So we are redesigning our relationship. It's based now on mutual accountability. To be able to do this, we have engaged with international and local civil society to advocate for policy reform and policy change. And this is a very important role of the civil society because they can influence policy at the local level much, much faster and much cheaper than any other international organization. So this is a very important move. We have what we call the Smart Advocacy Program at the local level, where we engage with local civil society to talk to policymakers, to stakeholders, to be able to be convinced that spending on family planning and procuring contraceptives is an investment. It's not money spent, it's money invested. And we provide them with the local context on the returns of these investments. So they become part and parcel of our investment at the local level to be able to modify this policy based on which, I mean, Nabeeha is making an example. Yesterday, we were very fortunate. We had many, in our side event, we had many governments announcing their domestic allocation of resources for the procurement of contraceptives.
And Nabeeha, you talked about products sitting on the shelf and obviously holding governments accountable, but what can you do to help just increase patient awareness and patient demand to go and take advantage of the products that are available?
Yeah, our partners in more than 35 countries approach us through a multifaceted, multi-layered approach. And it is very much around who is in close proximity to the communities that are facing the greatest inequities. Who do they trust? Who do they believe in? I mean, we have a very productive and symbiotic relationship with the multilateral institutions like UNFPA. There's no point in being aware of your rights and what is accessible to you if you can't actually get the goods and services, just as there's no point in having goods and services if people aren't aware. So for us, it is at multiple levels, engaging with the government, engaging, as I said, with trusted sources, with media, with community-based influencers, and also reassuring communities that as you go and access sexual and reproductive health care, as you go and ask for contraceptive access, you're not doing it out of turn and you're not alone. You have a whole community that is supportive of this, that understands why this is so important to the progress of all people, and that there's a civil society movement as well as important partners with government like UNFPA who are making sure that quality, trusted services and information is provided, and we can combat misinformation, combat lies, and combat the injustice of having options, having knowledge, and people not being able to access it.
Right, so a global effort, but within localized context. Well, thank you so much, Nabeeha and Dr. Ayman, for joining us today, and thank you to PAI.
Thank you.
Thank you.